get fever, these days you're afraid. Everyone is afraid whether have they got swine flu, or have they got meningitis, brain fever, or have they got dengue fever. So there's lots of fear about fever. And so what happens is everyone goes to the hospital or see the doctor. The doctor's room is crowded and there's no time to examine a person properly and find out what the cause of the fever is. So everyone gets an antibiotic because there's simply no time to see each person properly. So we need to stop that because that's dangerous. Let's look at what fever is. Fever occurs when germs outside our body, which we can't see, get into our body through wounds, through our lungs, or through our bowel. But don't be afraid, because there's one good thing. When germs get into our body and try to cause disease, in our body we have white cells. White cells are like soldiers. When germs come in, it's their job to fight these germs and kill them. But germs are of different types. Just like there's a small mouse, if it comes inside your house, you can chase it away by a little broomstick. There are some germs which are much stronger, like a tiger. You can't chase a tiger with a broomstick, you need a gun to shoot it. So in the same way, diseases or germs are different. Some germs are weak. Our own body's white cells will easily get rid of them. They can be treated at home by yourself. But some germs are like tigers. When a tiger comes in, you know you need a gun. In the same way, the white cells in our body, which protect us, can't kill that tiger germ. They need to be killed only by medicines that doctors can give. So you need to know when the fever is caused by a mouse germ or when the fever is caused by a tiger germ. How do you know the difference? Well, don't think that you need to see a doctor for all that. You can find out yourself whether the germ is weak or strong by a few simple symptoms. If the fever is still there on the 4th day and it's still high, it's not a simple germ. You need to see a doctor. If the fever is coming with repeated vomiting, then that's dangerous, because when you get dehydrated, the germs are strong and they can harm the body more seriously. Another thing is that if the fever causes you to breathe with difficulty, if you get short of breath, or if your child who has fever is breathing faster than normal, that's also not a good sign. So with just these 3 simple rules, if the fever doesn't get better on the 4th day, it's still present, or they're vomiting repeatedly, or their breathing is affected, or if you're sick in any way, you find it hard, you're finding it dizzy, and you can't get up and stand easily, that also is not a good sign. Then you need to see the doctor yourself. The other fevers, they're like mice. You don't need to go and see the doctor. You don't need a gun to shoot a mouse. You can treat it yourself. What do you need to do? You need a little bit of rest. That doesn't mean take to your bed. Go for small walks, but not do any strenuous exercise. Take enough fluids and take paracetamol. This is a very good and safe drug. If you can take it every 4 to 6 hours when you have fever and body ache. And with those treatments which you can give yourself, and simple treatments like inhalations, you can cure this condition yourself at home.
विरुद्धाहार चेष्टस्य मंदाग्नेर्निश्चलस्य च स्निग्धं भुक्तपदोहिन्यम् आमाशयं कुर्वतस्तदा. Jwara or fever is explained very well in Ayurveda, and it's classified 8 types of jwara or fever. Ayurveda says fever is due to the improper or irrational combination of food and irrational lifestyle, and it develops into symptoms. It's not a disease in Ayurveda, it's a symptom of many other illnesses. It says nidana or root cause of disease, and pragrupa or preliminary symptoms, and then rupa or clinical manifestations. Vata, pitta, kapaja and sannipadajan, and very important fever is agantuja or fever due to external causes like bacterial or viral infections. These are all very well explained in Ayurveda. Fever is not simply treated in many cases, but the first advice in fever, if you develop symptoms of fever, the symptoms of fever also again explained like distaste in mouth, lack of interest in working, cramps in the muscle cramps, especially in your calf muscles, rise in body temperature and loss of appetite. These are all the symptoms of fever. Even in rheumatoid arthritis or arthritic diseases or any other infections, rise in temperature is one of the symptoms of fever. So in treating fever, you have to find out the root cause of fever or jwara, and you have to treat it properly. The first advice, if you feel the symptoms of fever, is upavasa or fasting. Again it says semi-fasting. Drink warm water, drink water with shunthi and jeera, boiled warm water with shunthi and jeera, and follow payadikrama, like use only mild porridge. This is the first advice of fever, and don't follow only this advice. And if the fever is and the symptoms or jwara is not settles on its own within 24 hours or maximum within 2 days, you have to consult your vaidya and take his advices to control the fever.